Hey, I'm Dr. Elizabeth Roy. Thanks a lot for joining me. I want to talk about the root cause of erectile dysfunction and strategies to restore erectile function. Really important that you understand this. I am the owner and operator of Dr. Studio. We do research here, we're educators, and also I consider myself a coach because it's not easy to take people through the process of wellness. We all need coaching. So first, let's talk about erectile dysfunction and the prevalence of erectile dysfunction. Most men don't realize you are not alone. You're really not. 40% of 40-year-olds, 50% of 50-year-olds, and 70% of 70-year-olds actually have erectile dysfunction, severe enough that they go to a physician and they seek care. So it's a big deal. It's a lot of men. The definition is problem achieving and maintaining an erection. Either one of those or both is erectile dysfunction. You can have low libido and yet you might function just properly. We can certainly help you with this as well. But erectile dysfunction is when you're unable to get and maintain an erection. You know, getting and maintaining an erection is a very dynamic process. My hat is off to you guys. It's not easy. You have to have properly functioning nerves that actually run from the brain down the spinal cord into the pelvis and then innervate the vessels of the penis. It's a big deal. That stimulates a dilation of the blood vessels, which then leads to an engorged penis. You know, we all associate blood flow with erectile function, and that's absolutely true, but there's a lot that goes into that. In fact, I'm going to show you here. There's a large vessel in the middle, and then all of these little vessels here, little capillaries, are necessary to create a robust erection. And these can be affected by lots of things. I'm going to go through that in this presentation. They actually also have veins. So the integrity of this tissue has to be intact. The blood vessels, the little capillaries, the fibrous tissue here, the tunica albuginea it's called, the veins, the nerves going to the penis, all very, very important. Because the veins have to be able to to shut down and trap the blood in the penis in order to be able to maintain. So when I look at erectile function, I assess the nerve health. Super, super important. We look at the lumbar spine, if you've had any injuries, the sacral spine, even hip, knee, and ankle injuries can throw off the pelvic bowl. We do whole body thermography so we can see where this dysfunction is. And we can correct it. That's the beautiful thing. So we look at your back and the nerves and the muscles, everything that makes up that pelvic bowl. We all know, well, maybe you don't know. Clearly, if you're getting medications for your erections and you've never had a coronary calcium score or some other very sensitive evaluation of your arteries, your doctor probably doesn't know that erections are associated with heart health. You know, they actually say erections are just as good as your heart is. Well, in many cases that's true, and that's why finding this root cause is so important. There's tons of literature, recently written medical articles that show that changes in erectile dysfunction are very, very early warnings of cardiovascular disease. So what I do is help you to prevent having cardiovascular disease while we get your erections back on track. So this isn't a matter of, oh, well, yeah, too bad. You got to wait until you have heart disease or you're on your way to having heart disease. This is really taking and having a full respect for the erection as a symptom of an underlying problem and then correcting the underlying problem. That's the thing. That's what I do. I don't just wait for you to get a disease so I can write you a medication. No, we're using this to help us understand what's happening so that we can get you healthy and keep you happy. So we're going to do some assessments. There's some in-office assessments that are incredibly sensitive. Even if you had a stress test and your cardiologist put you through the paces. Look, I've saved several guys' lives doing this evaluation. Guys that had stress tests even within a 90-day period, and their cardiologist was resistant to what it is that we found in the office, and it turned out to be the truth. So plaques in the arteries, you can have a plaque in the artery of the heart, you can have plaques in the arteries that lead to the penis. Even the tiny little vessels inside the penis can have calcium buildup and plaques. You can have endothelial function dysfunction rather, sorry, that's a single cell layer inside the blood vessel. That can cause abnormalities with dilation of the blood vessels and contraction. It doesn't just have to be blockage. So erectile dysfunction doesn't always indicate an underlying heart problem, but it does very frequently. And we're able to assess what's happening here. So we'll be able to tell you exactly what's going on and why it is that you have this issue. You know, Harvard's Dr. Michael O'Leary says that erections really should serve as a barometer for overall health. Really important. So why is your doctor prescribing you medications, or why are you getting medications online, or why are you wasting precious time when you should be identifying the cause of this problem and reversing that cause? And not only fixing your erections, but also maybe saving your life. It happens. You deserve a full evaluation is really what it is. So let's just take a little closer look. This is a cross-section of a penis. So again, the blood flows into the middle of these two cylinders called the corpora cavernosa, and then into these little capillaries, creates a pressure as the penis expands. It pushes against this tunica albuginea, it's called. It's that fibrous sheath. And then it pinches off the blood flow out. So blood flows in through the middle, sorry about that, right in through the middle here of both cylinders. The cylinders expand, pressure builds, pinches off the blood flowing out. So when you're flaccid, blood is flowing in and out at exactly the same rate. As you're aroused, if everything's working properly, blood fills the inside here, creates the pressure, and then pinches off the blood flow out. If it doesn't, then there's a venous leak. And the venous leak can be because you're not building enough pressure. Maybe all of these vessels are atrophied because you have high blood pressure, even if it's treated. Or because you have high cholesterol, even if it's treated and your numbers look beautiful. Or maybe you have diabetes or pre-diabetes and your numbers look perfect because you're treated. That doesn't matter. You are still in the disease process, okay? And we can identify that and we can fix it. That's the beautiful thing. We have tools to fix this. Or perhaps, I'm sorry, I keep doing that. Perhaps there's some calcification or some thickening of this fibrous sheath and you can't expand it. We can really identify that and we can fix that as well. This is just an MRA, it's called. It's an MRI of the blood vessels. And you can see how those blood vessels have to come through the pelvis. This is one of your hip bones. This is the pubic symphysis. This is your pubic bone right here. So the vessels and the nerves have to come through the back, down through this pelvic bowl area in order to wrap around and innervate the vessels in the penis. So any kind of interference in that blood flow, again, from low back problems, from pelvic bowl dysfunction, can also interfere. The brain plays a major role as well. You've got to have the right neurotransmitters. You have to have the right dopamine and epinephrine. And, you know, this is a big deal. Can we fix that? Yes. We can identify what's out of balance. Sometimes you don't even realize that you're poor sleep or maybe you have some anxiety or depression. These can be related to your erectile dysfunction, believe it or not. It's a very dynamic process, as I mentioned before. Hormones play a big role. Now, maybe you're a guy with low testosterone and erectile dysfunction. You got your testosterone fixed, and you still have erectile dysfunction. Look, that happens. That absolutely happens. Hormones are not always the cause of erectile dysfunction, but you have to have optimized hormones if you're going to have the best erectile function, and if you're going to have the best libido and the best outlook, if you're going to be well. Men need balanced hormones, and this has to be done properly. Believe me when I tell you, there's a lot of inappropriate hormone replacement going on. Even the urologists struggle with this. They're not looking at estrogen. They're not looking at all of the different hormones. So when we look at penile health, we have to look at everything. We have to look at your back. There are lots of things that we can do. We can do physical therapy. We can prescribe different exercises for you. We can inject ozone or platelet-rich plasma or biologic allografts or stem cell recruiting factors, exosomes. We can use our shock wave. We also inject that pelvic bowl area, as I'd mentioned, we can identify if there are tight ligaments, if there's some restriction there. And we'll go right there and we'll inject it so we release it. So not only does your back feel better, but we're actually making space and making way for the blood flow through the pelvis. This is my shock wave. Fabulous, fabulous treatment because it's pulse waves, it's sound waves that are loosening up the ligaments and the muscles in the pelvic bowl and stimulating a regeneration of blood flow. But again, you got to know what's happening here. Hormones, as I mentioned, super important. And then blood flow. We're not only going to look at your systemic blood flow with some of the office procedures and coronary calcium scores that we do, but we're also going to look at the local blood flow, meaning what is the blood flow to your penis? We're going to do a dynamic ultrasound with a Doppler. So we're going to be able to look at the tissue of the penis. We're also going to be able to assess the blood flow and even measure the size of the vessels. This is the pelvic bowl, so looking from underneath, and you can see all of these muscles here. These muscles play a very, very big role in the way that blood is able to get to the penis and the way the nerves go through that pelvic bowl in order to get to the penis so that we can fire those vessels and cause a dilation, cause blood flowing into the penis to increase. Shockwave again absolutely helps with that. We absolutely are able to grow new blood vessels, open the blood vessels that are already there. It's very, very exciting. Let me go back to this real quick. So penile dysmorphia is just simply men who aren't happy with the size of their penis, or maybe there's a size that's changed. If you're not using your penis, you're going to lose it, meaning it will shrink. There is atrophy. We get fibrosis sometimes where now we can't expand, and expansion is so necessary. Some of that tissue dies, so some of those small blood vessels in there can die because there's not enough oxygen getting to the penis. So it's really important to address this, not only from an overall penile health, but also for aesthetics and how it is that you feel about yourself. So there's different procedures that we use for enhancement of the penis, for sure. Platelet-rich plasma will enhance the size of the penis quite frequently by, again, regenerating that tissue, growing new blood vessels. We use PRP to add a scaffolding to help with regenerating that tissue. We use shockwave, which is what that low-intensity shockwave therapy is, or shockwave lithotripsy. That's this right here. This helps break up any fibrosis, so we get nice flexibility of that tunica. It's more elastic now. We can help with venous leakage. We use the shockwave to the lower back and the sacrum. We optimize your hormones. We'll detoxify you and enhance your lifestyle so that whatever disease process in play here that's caused your erectile dysfunction, we can flatten that. We really can. It's pretty exciting. It's important for your family to have you functioning at your optimal level. It's important with your partnership. It's important that you have that intimacy and that confidence. We've talked so much about that. Some men have incontinence, so they're leaking urine. We can help you with that as well. Some men will have pain. Maybe there's pain with ejaculation. Maybe there's chronic pelvic pain from prostatitis. This is what we do all day. This is our specialty. So again, I mentioned hormones. DHEA is a precursor hormone, very important. I can't tell you how many guys come in here on hormones, on testosterone. Nobody's looking at their estrogen. Their DHEA is low. You need them all. You need a balance of the right kind of hormones. Both men and women need the right kind of hormones. Pregnenolone is the first hormone to be made from cholesterol. So we support that top end of the cascade so that your body is able to do as much as it possibly can at any age. At any age, you want to have optimal hormone levels. So as you can see, there's a lot of things that we need to consider if and when we get your erectile function back on track. I really hope that we meet you here at Dr. Studio, and I sincerely appreciate your astuteness in investigating the root cause and in finding the right clinic to help you reach your goal. Thanks. Look forward to meeting you.